Welcome back, dear viewers. Our first guest of the evening is Professor Faris Boufakhreddine, vascular and pelvo surgery, original treatment also of varicose veins and diabetic foot. Professor, good evening. It's really a pleasure to have you with us tonight on Hala Kuwait.
Me too. I'm very happy to meet you. And first, I apologize for my English. You know, my English is it's not very well because my maternal language, it's Russian, French, and Arabic.
Yeah, that's
so. When I working in French, we use French only.
Yeah.
In Russia, same. So English here, but not bad.
Yeah, I know. I'm really sure we will have an amazing interview with you tonight. Especially, we have an interesting subject to discuss with you tonight, Professor.
Yeah.
Professor, will you please tell the audience about your profession exactly?
You know, I'm a professor. I'm a vascular surgeon, professor in phlebisurgery. Phlebisurgery, it's mean the disease of veins, okay? Because in the world now, 75% is the world having varicose disease. It's serious.
It's really high.
Yeah, very, very high.
Yeah.
And you know, maybe with ladies and female, it's more because a big relation between the hormones and varicose disease.
That's interesting.
Yeah, hormones. So for this reason, we see more patient females, but it is heredity. So if one parent having varicose disease, half of child have it. If both parent, all kids have varicose disease.
Definitely.
So for this reason need to be, and now you know the new method of treatment of varicose disease, it's prophylactic. Prophylaxis of this disease, because varicose disease, it's chronic disease.
Yes. Definitely.
So no need to wait 20 years to see it very big.
Yeah.
And you know, the problem, it is damage of the valves, okay? So need to treat the valves.
Definitely.
For diabetic foot, you know, in the Gulf countries, many patients who have diabetic. For this reason, many diabetic foot, you know, diabetic foot, it's a big problem.
Yes.
Yeah, because diabetic foot lead to amputation. And I don't like amputation. Why? My father was diabetic and was amputation for my father here.
Oh,
you know,
unfortunately.
I was student in France.
Yeah, that's great.
When student, I cannot.
Yeah,
for this reason, I made this specialization to treat all the patients having diabetic foot to treat with very nice result. You know, already I work in Kuwait 12 years. I never make amputation.
Well,
all my patients will very nice.
Well, that's really a good news from you, Professor.
Yeah.
And speaking about the main causes, like sometimes, first, let's say good evening to the mothers and sisters and all the females are watching us tonight on Hala Kuwait, and especially the wives. They sometimes say they have this varicose. They believe it's because they stand at the kitchen a lot and they cook and they do the home cleaning and they supervise their children and they stand at work. And is it related to it?
Yeah, it's related.
Yeah,
you know, when it is heredity, so need to be careful. For example, obesity. It's not the cause of varicose disease, but it's a risk factor.
Yes.
And you know, the lifestyle daily.
Definitely.
Yeah, lifestyle. It's help to treat and to this varicose disease. Yeah. It is diabetic foot. You know, it is a bed sore.
Yeah.
This patient. Oh, now,
Yeah.
very nice picture
It's
for
explanation.
my new surgery.
Yeah.
Because now in the varicose disease, no need to make destructive surgery. Need to repair the valve because the saphenous veins, we need it for open heart surgery.
Yes.
So
exactly.
no need to destruct
Yeah.
it. Yeah.
Exactly. Is there any other causes of varicose veins other than the ones you mentioned? Because it can be risky for females and also for males.
Yeah. You know,
Professor.
when heredity, yeah, it's same treatment, but you know, the surgery of varicose disease, it's not stereotype surgery.
Yes.
It's not stereotype.
Definitely.
The varicose disease, it's fingerprints. I
That's
never
interesting.
saw same cases. So for each case,
There's
we
a print.
need special treatment. Special. So when we have, if it is primary, if secondary, it's serious. Because maybe how we can see if it primary or secondary, you know? If primary, it means heredity. If so, it's need time. But if secondary, after tumor, retroperitoneal, or post-phlebitic syndrome. Post-phlebitic syndrome, it's after phlebothrombosis. So if quickly we have big dilatation, it's very serious.
Yes.
Yeah.
Definitely.
So I like when some patient came to me, I like if it primary.
Yeah.
But no need to wait, because now a new surgery, it's under local anesthesia, half an hour work. After 2 hours of surgery, to whom? To work. With very, very, very nice result.
Yeah.
Very
that's
nice
the
result. Sometimes we have spider veins. If spider veins, it's very simple. It's injection, sclerotherapy or sclero foam. We have some picture here.
Yeah. They will view it
Yeah.
soon.
So
Yeah. This is.
yeah.
No, this one's related.
This,
to
this is
related
the
to
diabetic foot.
Yes. Yeah. From
you see,
diabetic.
yeah,
Diabetic
it's
foot.
diabetic foot, before and after. What? Diabetic. If you see necrosis in the finger, before,
Yes.
after,
Yeah.
nothing.
Yeah.
And now we have the new method. It's oxygen therapy. It's CO2 therapy. It's new. It's very simple. You know. Now I like medicine now, because it's
medicine's
very
developing.
yeah, it's helping. You know, and in cardiovascular surgery, 15 years ago, open heart surgery. No need.
Yes.
Yeah.
Yeah. Definitely.
Now,
Doctor.
now we make angioplasty.
Yeah.
Angioplasty without incisions.
Yeah, that's really great, because medicine is developing, and
Yeah,
thanks to
yeah,
you,
yeah.
there is a lot of optimistic news you just gave to us, especially like it's one-day surgery, and
One-day surgery.
yeah, and they can leave and practice their normal life at the beginning of the night or the second day, which is really interesting. Professor.
Before, after open heart surgery, 2 weeks in the hospital, we need transfusion.
Yes.
Now, angioplasty from here or from here, stent intraarterial in the heart, second day to home.
They
You
can
know,
it's
it's really...
Professor, you mentioned diabetic foot. Will you please explain to us what is the symptoms or like the signs of having diabetic foot? How it happens at the beginning?
You know, it's very simple, objectively, to see. When some patient diabetic, the diabetic problem or the diabetic foot will be start after 12 years, 15 years after
diabetes.
So, need to inspection every day for foot and toes, every day. Any change need to go to doctor.
Exactly.
Same day.
Same day.
Here I have many patients, my lovely patient really, because one diabetic patient, yeah, I see this patient every day to make change dressing. So sometimes he came like father, like brother, like mother, like sister.
Friendship grows.
Yeah, friendship
between
grows.
you.
Yeah.
That's really
For this
good
reason, need to be careful.
Exactly.
The diabetic foot, the causes of diabetic foot may be angiopathy, angiopathic ulcer, or neuropathic. When angiopathic, it's serious because the artery it's closed by atheromes. Okay, need to make sonar and to investigate.
Yeah, investigate. It's
investigate
really important.
Yeah, but when we go to doctor first day or second day, no problem. Maybe small wound, we can treat it in 2 or 3 days.
That's great.
But if 3-4 days home not coming to doctor, it's catastrophe. Catastrophe.
Of course.
So here every day when I see my patients, I ask, why not came 3 days?
They're supposed to maintain the visit.
So
exactly.
for that treatment, need to make swab, okay, wound culture to know the bacteria.
Yes, definitely.
Because need to treat with antibiotic.
Exactly.
What? To know which antibiotic need to make swab culture, and need to make change dressing daily. Need to make surgical treatment, debridement, to debride the bad tissues, necrosis, bad tissues, black. Need to debride it. And usually we have very nice result, maybe in sometime 1 month, 2. Sometimes maybe need 2 years to treat the ulcer. Because if not, going to amputation.
Definitely.
I detest it. I don't like.
Yeah. Is there any other types of treatment for a diabetic foot, other than you mentioned, Professor?
Yeah. You know, diabetic foot, it is when we have wound and ulcer.
Yes.
It's
this is the basic.
Foot. Yeah. But before diabetic foot, when we have ulcer and wounds, sure, need to be very
cautious,
careful, cautious, and need to with treatment, oral treatment, okay, oral treatment like aspirin, anticoagulant, and the treatment for the dyslipidemia. Dyslipidemia when we have cholesterol and the
that's really essential also.
It's need.
Definitely.
And be careful, because very small wound home, okay, it will go to amputation if.
Definitely.
Yeah.
Especially
and
during the winter.
And sometimes need very simple work. So inspection daily, okay, and need never no need to go home barefoot.
Yeah.
All time need.
Definitely.
Because sometimes we have something in the home. We can go and answer. And all the patient having neuropathy, the patient, he cannot feel no pain, nothing.
Exactly.
So third day, fourth day, he see big problem.
It's risky also, Professor, like during the winter, some people with diabetes, they put their foot nearby the heaters, which is really risky.
Now, in
Kuwait,
cold, I have maybe now 10 or 12 patients with serious diabetic foot after burn. After burn, the heater.
The heater.
And
they put their foot,
and the patient
is not
no
aware,
feeling.
It doesn't feel.
In the second day, third day, coming to me, oh my God, oh my God.
Yeah.
And you know, sometimes during shower,
during the shower,
need to verify the water if it's very hot.
It's risky.
Yeah, big risk. It's risky. So need to verify the water before going in the to the shower.
Professor Faris, you give us really interesting information tonight. Before we end our interview, people always wonder when it comes to varicose veins and diabetic foot, they always wonder, can it go away by itself, both of them, or it has to be treated when it comes to varicose veins and diabetic foot? What will you say about it?
You know, in diabetic foot and varicose veins, it's not stereotype treatment. For every patient need
special treatment,
special case, special treatment.
Definitely.
For this reason, need to inform the people. If we inform the people what's the problem, okay, will be very nice. Will be really very nice. Exactly. So, and need to be take care. And yeah, in the diabetic foot, same. When we nail cutting, it's very, very, very dangerous.
Yeah,
if some patients making it, need to go in the salon or in the doctor, because we have special instrument for it. Or sometimes the patient, diabetic, having a problem with the eyes. He cannot see where need to go. So maybe son or daughter to make it for him. Yeah, because it's very, very, very dangerous.
Definitely,
yeah,
definitely. Thank you so much, Professor Faris, for being tonight here with us in Hala Kuwait. It was really a pleasure to have you with us here tonight.
Thank you.
And hope to see you soon.
Thank
and you promise you'll take me to Europe with you.
Yeah.
Yeah. Hope you enjoy your evening.
Okay.
Thank you so much.
Thank you.
So much.
Thank you.
Enjoy your evening, Professor.
Okay. Thank you. Thank you.
Dear viewers, we just had with us Professor Faris Boufakhreddine, vascular and pelvis surgery original treatment, also of varicose veins and diabetic foot. Now, let's go to our second report of the evening. It's about the Statue of Liberty. Stay tuned.